Hello and welcome to the Lift Up Journeys podcast. My name is Katie and I am one of the founding members of Lift Up Women in Life Sciences, a community created to connect, champion and inspire women from academia through to C-suite across the life sciences industry. I'm looking forward to sharing with you an inspiring collection of career stories from a group of wonderful women who work in leadership positions across the life sciences industry. I hope by listening to these stories, you will feel inspired in your own career and gain the skills, confidence, and knowledge you need to climb the career ladder and break through the glass ceiling. Today, we are joined by Lisa Stehno-Bittel. Lisa is currently the president and founder of Likarda, a biotech company developing enabling technologies to transform the way cell therapies are delivered and optimized. Starting as a physical therapist, Lisa saw the impact of new healthcare innovations on the recovery and rehabilitation of patients following a range of diseases and injuries. Lisa has a PhD in physiology and postdoctoral fellowship at Mayo Foundation in pharmacology. In her time in academia, she focused her research on diabetes and cell therapies and developed a number of innovations that resulted in patents, and the large pharma took notice. Likarda started as an idea in a scientific laboratory and quickly grew into a successful small business. The company is unique in the biotech industry, focusing early on revenue generation and lean management principle rather than VC investments or federal grants for operating capital. Solid science and a keen business focus have coupled to provide her clients with delivery systems for their biologic therapeutics, including cell therapies. Lisa's also recently been named in the top 50 women leaders in Missouri by Women We Admire. So what an introduction that is, Lisa. How does it feel when you hear it all back like that?
Yeah, it's been an interesting journey. You can tell from just saying that I started as a physical therapist that this is not where I expected to land. When I was young, I thought physical therapy would be my career, and I did love working with patients. But I also knew I wanted to move my career up. And I initially started moving up the hospital administration chain and quickly found out that was not my cup of tea. I really didn't like hospital administration. And that's when I decided to go back and get my PhD. And my father taught at a university his entire career. So that seemed like a great option as well. And that's where I landed after my PhD and postdoc.
Amazing. It's a fantastic journey for you to have been on. And I can't imagine when you were a young child growing up that you anticipated you'd be here now, founding your own business, Likarda. Talk to me about what it was like when you were much younger, Lisa. What were your dreams when you were younger?
Yes, I think my dreams were really to have a career that I could advance. And I think early on, I really didn't have a defined path, unlike some people who know what they want to do from day one. I remember in college, every semester I declared a different major. And finally, the university said, you have to declare one major and stick to it. I was everywhere from art history to archaeology to anthropology, and then finally landed in physical therapy because I was injured playing basketball and went to a physical therapist and learned about the career that way. So I always knew that I would be a person to advance, not to just stay in one position my entire career, but I really didn't have a plan for what that was going to be. And it took me pretty late in my career to figure that out, or pretty late in my education, I guess, to figure that out.
Fantastic. And obviously the sporting injury clearly changed things for
Yes.
you. Did you play sport frequently when you were a child and growing up?
And, in high school, I ran track and played a little volleyball, but I wasn't very good at either. But so this was just, messing around back behind the building, the dorm where I lived, just recreational. I've always been involved in recreational sports. My husband and I still snow ski and water ski and enjoy biking and other things.
Yeah. And it was that freak injury that really gave you, I guess, an insight into what a physical therapist does, right? Because when you're young, I don't think many people often understand where medics and physical therapists and rehabilitation, where that kind of comes in. And interesting that that was then something you felt like you wanted to really go for your own career.
Right. If you're good in school, in high school, and even in college, you're pushed towards a medical degree. That's what you should do.
Yeah.
But there are so many other ancillary support or healthcare careers related to improving people's lives. And I do think an important aspect is your own personal quality of life. So I was not drawn to medicine because I wanted to have a life outside of my career as well. And physical therapy really gave me the opportunity to do that, to impact people's lives directly. The physiotherapist spends way more time one on one with an individual patient than any physician is allowed to in today's healthcare system. So you get those rewards, but you also have a life outside of the hospital and the clinic.
Yeah. And was that important for you to feel that you had more of a balance between what you could do professionally and also what you could achieve personally outside?
It was important. I knew that was one thing that I was going to work towards. And again, it's why I moved away from or chose not to pursue a degree in medicine. I knew that that would suck a lot of my energy and time. And I watched over my career, I watched a lot of young female physicians because I was on faculty and a chair then at a medical school, and I watched so many young female physicians burn out because they were just trying to do too much, and they couldn't find that balance and they left the profession. And that's always devastating to me to see that
Yeah.
happen.
Yeah, absolutely. And we see it so often with women burning out in general, and particularly in the medical field. It's a shame that you see it. I'm pleased, hopefully that didn't happen for you. What was your journey like when you first started in university?
Yes. So my first faculty position was as, of course, an assistant professor, working to get grants, working to support my graduate students in the lab working. And so there was certainly pressure there. The way I found to balance it was I'm a morning person. So I would set my alarm for 4 o'clock every morning. And from 4 to 6, I would write grants. I would just sit here at the house
Wow.
and write. 6 o'clock, I get the family up and we'd have our day because I'm just not, my brain just doesn't work in the evenings. So for the first probably 3 years of my faculty career, that was my schedule. And I always joked that I had bags under my eyes, but it worked for us. So yeah, I don't think that I was doing that work while the kids were asleep, so they didn't miss out on anything. I could still have my evenings with the family, and it just worked for us.
Yeah. And you touched earlier on the fact your father worked in faculty as well, I
Yes.
believe. Do you think that influenced your decision to go into the faculty route?
It did. It certainly did because at that point in my life, when I knew I didn't want to be in hospital administration, I did not consider industry, which is where I ended up landing. And I think that is because of the influence of watching my father in the academic setting, and he loved teaching so very much. Um, in hindsight, for where I ended up, going from hospital administration to industry probably would have been a more direct and maybe even more beneficial path for me, but I didn't even consider it at the time.
Yeah. And I'm assuming that has come down to a lot of the characteristics that you've probably shown at various points, not just in childhood, but early in your career as well. How would you define the characteristics that you had during that time?
Well, a lot of grit. I can tell you a couple stories that were influential. When I was a postdoc and student, a graduate student, I was mentored by great men and really able to grow in those roles. As soon as I launched into my own career, and now I was competing with all of them for grant money, for that limited grant money, for positions, for manuscripts, suddenly I didn't anticipate that I would now be seen as a as competition. And that happened overnight. And no one warned me that that was going to happen when you go from a mentored position to your own faculty role. And shortly after I took my first faculty role, I was invited to speak at a Gordon conference, which is a very prestigious invitation only event for scientists. And this one was at Oxford. And I was only one of two women invited, and actually only one of three women even participating, even in the audience. And I spoke on the first day just before lunch, and I gave my normal scientific talk. And then we all went to lunch together, and I was sitting with the other women, and we could hear the other tables saying, well, that was very different. Her presentation style was, so feminine, and I guess we're just going to have to get used to that. This was, I have to think what year this was, 1995, 96. So I had thought we had come way further than that. And I went back at that time. Again, I'm in a physical therapy department. I'm a new faculty member. The great thing for me was that I was, previous to my graduate education as an undergrad and in my first jobs as a physical therapist, my mentors and supervisors were all women. And I hadn't thought about how important that was until later in life. So I go back to my physical therapy department, and these women, my response was, you know what? I didn't enter science to break down barriers. I entered science because I love science. This is not what I signed up for. I can teach and be perfectly happy teaching, and I don't need the aggravation of writing the grants, doing all of that extra work, and I will teach and be happy. And they collectively put their arms around me and said, you're going to go back out there. You're going to get back in the lab, take a couple weeks to lick your wounds and get back in the lab. And that's what I did. So that was a very pivotal moment, having female support at an early point in my career.
When did you first have your first mentor?
My first mentor was in high school. Well, I had a couple really important people in high school, but one of them was my first boss. Georgia Moore had owned her own travel agency. And again, back in the 80s, for a woman to own her own business was a big deal. So
Unheard
I
of.
was a high school student, and I would go in after high school or after school on weekends and make reservations. Back then, you couldn't make your own airline reservations. You had to work through a travel agent. So that was a lot of fun. But and she was quiet and thoughtful and kind, but strong. So she was my first real female role model. And then, as I said, my faculty members in my undergrad, in my physical therapy program, were all amazing women with stunning careers. And so they also were huge role models for me.
Fantastic. Do you think, in your own opinion now, Lisa, probably being a mentor yourself now for other people, do you think it made a real big difference for you, the fact that those mentors were women? Because you touched earlier on the fact you'd also had a man mentor as well. Did it make a big difference for you that they were personally other women?
It did. And I didn't appreciate it at the time. Um, just a couple months ago, I fully retired from the university. I had been teaching a class here or there and keeping a part-time position. And I was asked to give an inspirational talk at the alumni weekend. So I was able to go back through my career and look at the mentors. The title that I gave for the talk was "The Shoulders I Stand On." And it was amazing to me to go back and see how many female mentors and role models I had along the way. And I think, especially for someone in my age group, that is quite unusual and remarkable. And I do think it gave me courage, some fortitude, some grit that I might not otherwise have had.
Definitely. And that characteristic, the grit, the determination that you've shown, has set you in really good stead to now found your own business. Can you tell us a little bit about the journey that you had from working in faculty through to founding Likarda?
Sure. If you had asked me even 6 months before we founded the company, was I going to run a company? I would have laughed. It was not something on my radar at all. I had with my graduate students several patents. They were around how to better make transplants for people with diabetes, cell therapy transplants. Transplants were already being done, but they were very inefficient, and the outcomes were not as good as not as reliable as they should have been. So we were working on ways to improve that process. And in doing so, we created organoids, miniature organs, for insulin producing cells, um, again, for transplants. We were presenting these data at a scientific meeting, and scientists from Eli Lilly said, "Hey, that's interesting. Could we screen drugs, new drugs on your organoids?" And we were really the first in the country to be able to do high throughput drug screening in 3D organoids. And it's important because when cells attach to a plastic dish, it changes them genetically, protein level. And so they're not going to respond to a drug the way they would if they're attached to other cells as they are in the body. So we got a grant from them first, and then they asked about sending blinded compounds to us. And that's when the university said to me, "This doesn't look like academic research anymore. This looks more like a business." So we spun out, but we were still really working out of my lab, but starting to generate revenue. We had clients almost immediately, where other companies, and it kind of came out in your introduction, where other companies a lot of times start with grants, and that's how they fund early research, even as a business. We already had clients. So we were revenue positive in 17 months, and were then
Wow.
able to leave the university setting to move into our own space. Um, the profits from the contract research we were doing for pharmaceutical companies, we put back into our cell therapies. That's always been the passion, is curing a disease rather than just treating the symptoms. Uh, and we did that, and that went really well for several years. Then other large contract research organizations started getting into our space. So I was losing out on bids. Our profit margins were going down, and now there wasn't the profit to put back into the cell therapies. And that's when I met our investor, Peter Worth, who said to me, "Lisa, you could go so much faster on your cell therapies if you just took my money." And at that, I have to say, I was pretty arrogant, because I was able to walk around saying, "I don't have an investor. We bootstrapped this." And that's kind of a big deal in industry and unusual. But it became obvious to me over time that I needed to set my arrogance aside. And he was right. We could go faster on the cell therapies, the things that were really important to us, if we brought in our first investor. And so we did.
Wow. That's such a journey to hear how you just made the discovery in your role in academia to it becoming a business almost overnight without you necessarily realizing. And that was your transition into industry. Had you
Yes.
ever previously thought you would ever break into industry, or did you really feel like academia was where your heart was?
Yes, absolutely. Absolutely. In fact, I had a retired physician who enjoyed playing around in my research lab, helping with surgeries on the animals and things. And so when he heard that we were even thinking about a company, he said, "Well, I'll fund it." I've made all my money. I'm retired now. I don't need control. You can run the company the way you want. You don't need to worry about paying me back. He said all the right things. And I said, okay, I have an angel investor from day one. And then as we put the operating agreement together, it was clear that he needed complete control over every decision we were going to make. And it was going to be awful. The company would fail if we moved forward that way. So I made a decision that, you know what, I love my lab, my students, teaching. I don't need to do this. Let's just put this on hold, right? And I told my family that. My father immediately said, "Thank God, that man was trying to take too much money from you, and that was a terrible arrangement you had with him." And I have put money aside. When you said you wanted to start a company, I put money aside for you. Here's your money. Go start your business. So that I think shows you that there was still conflict in my mind. I wasn't sure this was the right thing. And then starting the company with family money was so stress inducing. I didn't sleep for months for a full night, and still don't a lot. There's a lot of stress of running a company. But yeah, I had to get over that. And I think that's the other thing point I would make is when you do start a company, it's a family affair. Not only my parents, but, my husband, we practiced living on just his salary because we knew there would be times when we needed to increase the runway for Likarda, and I would not take a salary. And that's happened many times through the course of this journey. So the whole family has to be involved. There were times when early on we didn't make payroll. That came out of my husband and our savings account. So when you're starting any startup, unless you already have investors lined up, it is truly a family sacrifice that everybody has to be involved on and on the same page.
And how important was the support of your family in this decision for you?
It's the number one thing. You can't do it. I can't see how you could do this without the full support of the family. And I would say another thing, timing is very important. And I think this is where I have watched them put their careers aside, as I said, burn out as physicians because they took on too much at the wrong time in their lives. So for Likarda to start, I was already a place where one child was launched and another was heading into college, right? So it was the right time for us. And my husband had a great job with a steady income. We could make this work. I can't imagine when I see graduate students coming out of their PhDs thinking they're going to start a company and maybe have a young family. I don't know how you can do that. And I would say to especially women, there's a phrase that I absolutely hate, and that is, it's a chance in a lifetime. There is no one chance in a lifetime. If you are passionate, work hard, focused, you will have opportunities presented to you throughout your career. Your job is to pick the right time for you. And if it's not the right time, to be brave enough to say that, thank you for this wonderful opportunity. I would want to do this and make it a priority for you. And I just can't at this time, but let me help you find some people who would be good in this role. Again, never worrying that you missed that one opportunity. There will be more. I started Likarda, well into my 50s. I learned to ride a motorcycle on my 50th birthday. You will have opportunities to do things your whole life if you're passionate, focused, and hardworking.
That's fantastic advice. I wanted to circle back to obviously where you are with Likarda now, because you mentioned you have a VC on board, Peter, I believe.
Yes.
How has that relationship developed?
Mr. Worth is the greatest investor. All the way through my career, I'm always amazed at how just the right people are brought to me at the right time. And Peter Worth was one of those wonderful people. He has been our greatest cheerleader, our greatest supporter. There are times along the way I've had to go back to him for more help, and he has always been there for us. So Peter Worth started Chemworth. He's the founder and CEO of Chemworth, which is one of the largest manufacturers of active ingredients for generic drugs in the world, certainly in the country. So he is a strategic partner. He knows the pharmaceutical industry inside and out. So he was more than just a normal investor. He really brought that strategy to us as well.
Fantastic. And Likarda has developed hugely since his involvement, and
Yes.
your role will have developed hugely too. So, talk me through the day-to-day of what you do now.
Yes, really important question. And again, another life lesson for me. I believed as a scientist that great science was going to win. And eventually we would be acquired because we have amazing science. And we do. And I can't take credit for that. That's the staff that work at Likarda every day. They are brilliant. But I just thought we would eventually get traction. And what I did not appreciate is the lack of business networks and business experience, business strategy that I was missing. So just in this year, we have brought on people who have that experience. And Stella Banook is one of them. She's been one of your speakers on Lift Up
She
before.
has. She's
Yeah.
wonderful.
And I, again, so lucky. The timing was just right. She had an opening in her busy life of startups and business strategy to be able to help Likarda. And so I brought her on as our CEO. And I've stepped into a role now overseeing more the science side, which is where I'm comfortable anyway. And she has brought all of that new strategy, new connections to Likarda that has jump-started everything we've been doing. We have new clients. We are expanding beyond just cell therapy for the use of our hydrogels to biologics, delivering antibodies, delivering small molecules, something I probably would not have considered on my own, but she brought that to the table. So I think we have to be able to appreciate when we don't have the expertise and when it's time to bring in somebody else. And I was probably late now, and again, in retrospect, I was late to the game. I wish I would have brought in Stella or someone like her 2-3 years ago. I think it would have moved us along faster, but we've got the team now and it's very exciting.
And what characteristics do you look for in your team? Talk to me about culture, personality, the values of your team. What's important for you at Likarda?
I am still a teacher and a mentor at heart. I have my co-founder was my graduate student, one of my graduate students at the time, whose patents Lilly and these other companies were interested in using, the organoid patents. And then I brought more of my own PhD students, as well as students, PhDs that were new grads. I like working with a younger workforce. They keep me nimble and up to date on what's going on. I'll put out a little shout out. We are going to be doing a podcast on artificial intelligence and using AI in manufacturing cell therapies. That's not an area that I'm really comfortable with. And I'm actually going to be moderating it. And other people who have more experience and are better in that field are going to be our speakers. Just having a young workforce, I think, keeps me engaged and moving forward. But also their teamwork. So Karthik Ramachandran is the graduate student that he and I founded this. And we sat down and wrote out our culture before we ever hired the first person, because we said, where do we want to work? What's the kind of place we want to come to work to every day? So supporting each other, cross training. In a small company, you have to all cross train. So we have people who are hydrogel experts, but they've also learned to do cell culture and all of those. So you're constantly cross learning and picking up new skills along the way, because you have to when you're such a small company.
Absolutely. And the culture is so important. It's so important. And I think so often we think about somebody's job, role, and responsibilities around their technical skills. Whereas actually, when you're a small business and as innovative as Likarda are, the culture has to bind you together. And that diversity of thought across your team is so, so important. And I love the fact that you wrote the culture before you hired anybody, because that is definitely a learning I'm sure you've taken from previously in your career when
Yes.
you've realized the importance of culture. You also talked about building a business based around people that you have mentored or people you have coached. When in your career did you realize that coaching was something that was so passionate for you?
I think it really became clear to me when I became a chair of a department. Um, I made some mistakes early on because I'm a fixer. I want to fix things. So people would come to me with a problem and suddenly became my problem and I had to fix it. And that's really not mentoring. I had to learn to step back and maybe not read that email first thing in the morning, but let it sit there even a day, because oftentimes if that problem sits on their desk for even a few hours, they'll figure it out instead of running into my office. But that role really taught me a lot about mentoring students, junior faculty, experienced faculty, um, and as I said, physicians as well, because again, I was one of the few female chairs at the university at the medical center, and so females, having trouble or questioning their careers would often find me to discuss those topics.
Wonderful. Did you face any challenges in your career being a woman?
Well, yes, I gave the example of the Gordon Conference. I always tried never to use being female as an excuse for anything, but my background, my PhD was in physiology, but really focused in biophysics. And biophysics, especially in the 90s, was a male dominated profession. So here I was as a physical therapist in this female dominated profession, but my research career was very much in a male dominated field. And there's some opportunities there. There's some advantages. You may get asked to be on committees or things because they need female representation. But I do think there were, especially early on in getting grants and competing head to head, some negatives with that as well, some challenges that you just have to be more diligent, more work harder, put in more grants. When I first started, I had a rule for myself: 7 to 10 grants a year, and 7 grants submitted would typically result in one funded. So it was a 7-to-1 ratio. That was a lower ratio than a lot of my male peers were having to put in. And maybe I'm just not as good a grant writer, although I taught grant writing classes. I don't really think that was the problem. But the other challenge for me was coming from a university in the Midwest, the University of Kansas Medical Center. It's not Harvard, it's not Stanford, it's not on either coast. People don't think of it as a research center. So that was another barrier that we had to always overcome.
Very interesting. And for you now, looking back, Lisa, what advice would you give to women who are in academia and maybe thinking about making a move to industry? What would your advice be for them?
Yes, my advice, quite honestly, would probably be don't try and start your own business. You need to get into industry first. I think it's a great move to make. There is so much opportunity in industry. Um, and yeah, so I would encourage anyone to do that. PhD student, you're kind of pigeonholed into going into academia. I would say look at industry. Please look at industry. And for faculty who are looking for something different, go to industry as well. but it would have been a much easier path for me had I moved into an industry position as a chief scientific officer for a mid-sized company. That would have been a much easier move, and then move into starting my own company after I had built that network and understood how industry works, because I was very naive early on.
Yeah, that's wonderful advice. If you were to look back on your journey, Lisa, what advice would you give to a younger Lisa? If you could go back and talk to her now, what would you say to her?
That's a really good question. We talked about the importance of family in supporting your career, no matter what the career is. I think I would say to my younger self, um, this is going to sound silly, but go marry Doug Biddle. You go marry that man. Um, Put away any second thoughts or concerns or cold feet you have, because when you find someone that not only supports your career, but will sacrifice their career for yours, everything else is going to work out. Whatever that, if you just have that partner to help you, everything else will work.
Wonderful. That's great advice. And I hope he listens. I hope he listens to this podcast. I hope he listens to the next podcast and realize how much of an important role he's had to play for you. I'm sure he's aware, and I'm sure he's super proud of everything that you've achieved. We are very grateful to have you as part of our Lift Up Women's community. I guess I wanted to hear from you, Lisa. Why do you feel so passionately about being a part of Lift Up?
Yes, I know you've been around for over a year. I was introduced to Lift Up only about 3 or 4 months ago, and I have listened to your live LinkedIn interviews with really amazing women on topics that are so dear to me and important to all women in the workforce. I don't know of another organization doing what you're doing. And so, yes, I am a huge fan of this endeavor, and want to support it any way that I can.
And we're really grateful to have you on board. I know for us, we are so passionate about really inspiring the younger generation, particularly of women in our industry, and encouraging them to join us here in this crazy life sciences
Yeah.
world and enjoy everything about it that we all do. For you, Lisa, if Likarda hadn't have been an option for you, where do you think you'd be now?
I'd be a dean at a university. I was kind of being groomed to take that position. And so, yes, that would be what I would be doing. Uh, I'm glad I'm not. I think this is more exciting, more challenging, more sleepless nights. It's harder, but it's also a lot more exciting for me. So it
Absolutely.
turned out accidentally to be a better fit for me.
Absolutely. Well, that is truly wonderful to hear. Thank you so much for taking your time to share your story today, Lisa. I'm sure it will inspire many of our listeners today. Hopefully, it will inspire a generation of those in academia to come and give industry a try. And I'm sure I can also speak for Lisa here in saying that if you are open to connecting, if you are looking for a mentor, a coach, even somebody to give you some advice, Lisa would be happy to stay in touch.
Absolutely. Absolutely, Katie. Anytime.
Absolutely.
Reach out to me on LinkedIn. I'm happy to do whatever I can.
And thank you so much for joining us today. I've been inspired by your story. I think it's wonderful. And thank you for taking the time to share it with us.